Hey, I'm Jamie.
I'm Elaina.
Hi, I'm Gabe. So, Jamie, we were at the Supreme Court this week.
We were.
What'd you think?
It was rough. I mean, it's really funny
It's one
because
word for it.
Jessie Hill is amazing. She's an attorney that works sometime with the ACLU. She's a named chair of a department, I think, and everything. Her resume is ridiculous.
Professor
Harvard,
Hill.
Yale. Yeah, Professor Hill, constitutional law expert. Did an amazing job arguing for our side. But I think what really flabbergasted me, and I'm used to this in the state house, we're used to some rando person coming up and just spewing inaccurateness.
Right.
But happening in a courthouse with an attorney, like from the attorney general's office, like salary that my tax dollars pay, getting up there and just like...
It made you angry?
Yes, it did. It made me very, very angry.
So the case is Preterm v. Kasich.
Mm-hmm.
It's actually a longer name, but I'm just shortening it to Preterm v. Kasich.
Mostly because that's fun.
Yeah. So Preterm is suing John Kasich as governor for having signed into law a budget bill in 2013, in this case, that included multiple abortion restrictions.
Yes.
The budget is supposed to be a single subject bill. All bills are supposed to be single subject. And the subject of the budget is supposed to be the budget, not the budget plus abortion restrictions. That's different subjects.
What?
So they've filed this case. Preterm has filed this case saying that adding in abortion restrictions. So there's specifically pointing to the transfer agreements and some of the provisions from an earlier version of the 6-week bill. Back then, everybody was calling it the heartbeat bill. So they took some of the elements out of that piece of legislation, not the abortion ban, but all of that, wedged it into the budget and passed that in 2013. Preterm is saying, no, we shouldn't have to follow all of these restrictions because they were passed illegally as part of what should have been a single subject budget bill.
Yes. But this case wasn't about that.
Yeah, that was the part that I didn't realize until it was over.
So this has been a case that's been going on since 2013.
Wow.
It's 2017. Let's think about that for a second. And they're still arguing over whether or not Preterm has standing and the ability to sue the state. So they're saying that an abortion provider doesn't have the right to sue the state about abortion restrictions because they can't prove that they've been harmed by the restriction. But they have been.
Right.
So, they're not like Capital Care in Toledo, where, if they lose this case, they're going to close. But it does. It's a extra burden of paperwork. The transfer agreement has to be signed every 2 years instead of just something that automatically renewed every year like the previous ones. They can't turn to public hospitals like Metro any longer, so it limits their options on where they can get transfer agreements. Luckily, they've been able to continue to secure one from university hospitals up there.
Right.
But, at any time, university hospitals could say no, just like Ohio Health did here in Columbus last year to Founders and everything else. But then also the ultrasound restrictions and, punishing doctors for not following stupid informed consent laws where they're forced by the state to give medically kind of ambiguous information about healthcare to their patients and those kinds of things.
Right.
So they're definitely impacted by these laws. The fact that the state can argue that they're not is just ridiculous.
Right.
But for 4 years, that's what we've been arguing about.
Yeah. I've been working on a description because we're looking to the state to put out their annual induced abortion report, which tells us how many abortions took place in a year. And so I was putting together some materials for that. I started thinking about it because we've seen this trend of fewer and fewer abortions every single year, and that's been going on since 1990. That's not due to partisan politics. In some cases, it's due to increased healthcare, so it's not always a good thing or a bad thing. But we're looking at why it's happening here in Ohio, and sometimes the rate of change increases or decreases dramatically. When they put these sort of restrictions in there, in Preterm's case, the transfer agreement thing, this isn't the clinic that's most threatened. I mean, Capital Care is at risk of closing immediately. When they put in the forced ultrasounds and the mandated counseling and all of that, you kind of have to look at it almost from a business manager point of view. If you are running any sort of a business, if there's something that gets put in place, some sort of rule or regulation that slows down your employees, forces them to take time, forces them to use extra resources, that reduces the number of, customers or patients that you can see in a day. And so by passing a forced ultrasound rule, you're telling the clinic they have to take some of their resources and take up some time, and it just slows everything down. If this was a standard business and you told the business owner, hey, we're passing a new regulation that doesn't benefit anybody.
Yeah.
That's going to reduce the number of patients that you can see or customers that you can see, however you want to phrase it, they would be livid.
I mean, look at the national EPA clean air rules and, how the coal companies are screaming from the rooftops and forcing Trump to repeal Obama era rules and stop things from being enforced and everything else. I mean, that is exactly the same kind of things they've been doing on abortion clinics since Kasich took office. Overregulation for absolutely no reason. In the coal companies' cases, we all kind of need to breathe, and it'd be really nice if our air was cleaner. So actually, there are needs for those rules. So, again, this is a completely different scenario because these don't increase patient safety. They don't impact anything.
Right. They're clearly designed to prevent women from accessing abortion. And I really believe that one of the big ways that they reduce access is by just slowing down how clinics can see, it takes a doctor's appointment and it makes it that much longer, which means they can see that fewer patients, and it's already a waiting period to get into a clinic.
Yeah.
This is part of it. So I think that especially in preterm v. Kasich, the mandated ultrasounds is the bigger argument here.
Yeah.
Both of these transfer agreements and ultrasounds should be, knocked because they are violating this very clear single subject rule.
Yeah. Well, and to bleed into some other court news in other states, I think one of the other pieces of the ultrasound is the shame and stigma piece. And, there is no need for an abortion clinic to do an ultrasound and listen to fetal heart tones and do all these things that's required by Ohio law, other than to kind of rub women's face in what they're doing and shame them and put additional stigma on them. And so
exactly, which is why in a federal court in Kentucky, determined it was unlawful to force ultrasounds, and this week decided that that can't stand any longer in Kentucky.
So that was really good news out of Kentucky, and that was a piece of the preterm case here too, is the additional stigma and shame that goes along with these required things. Luckily in Ohio, they aren't forced to hear the heartbeat and aren't forced to hear the descriptions and those kinds of things that the doctors in Kentucky were forced to do. They have to be given the option to hear those kinds of things. So Ohio's law is slightly better, but not dramatically.
Right.
So what's next for the case then?
In Ohio, we wait and see what happens. I don't know how you guys talked about the capital care case, but I mean, the because I wasn't here. But the Ohio Supreme Court are politically elected, just like our other statewide elected officials. So it is a 5 Republican, 2 Democrat court. So the chances are against us in the first place because of that. And it'll be interesting to see. In general, cases are handled within like 6 months or so, but our lawyers have said that they've had cases sit there for 1.5 years. So it's at this point just to kind of wait and see.
Right. Elaina, you brought up Kentucky, and that's a terrific point. The courts there struck down a requirement for ultrasounds. And this was, showing the woman fetal images. This was clearly an attempt to try and shame women. They had to listen to a heartbeat. Kentucky isn't the only state in the Midwest that we're looking at to see changes to policies. In Indiana, a federal judge permanently struck down provisions of an Indiana law that would have banned abortions sought due to fetal genetic abnormalities and required that aborted fetuses be buried or cremated. So this is a couple things that deal with current legislation that we're looking at right now. The fetal tissue burial requirements, but then also this applies directly to the Down syndrome case that we're looking at.
Yeah. So, 2 of Ohio Right to Life's 3 legislative priorities for the fall have just been struck down in Indiana. So be, nice if our Ohio legislators kind of looked to Indiana, our neighbor to the west, and said, hey, wait, maybe we shouldn't bog the taxpayers down with paying legal fees for an unconstitutional bill that we're going to pass.
Right. Yeah.
Details. My taxpayers, your taxpayer, taxpayer dollars, they should go to, helping people, not stupid lawsuits.
And then good news in a third Midwestern state, Illinois, which I saw this and I was kind of like, really? Illinois' governor signed a piece of legislation into law that says that abortions may be covered by private insurance and also Medicaid.
Woohoo!
That's amazing.
Yes, It is amazing. Look what good things legislatures can do when they aren't bogged down by doing ridiculous bad things.
Right. So can you kind of describe for people exactly why that's important?
Basically, it allows more access, and particularly for low-income communities, families, women who rely on Medicaid to be able to, access abortion care should they need it.
Yeah.
As simple as that.
Yeah, I think it was really interesting. We talk to folks all the time, and sometimes talking about funding. Public funding is something that's a little tougher because you get this argument of, well, my taxpayer dollars shouldn't go towards something I don't agree with. Well, there are a lot of people who don't agree with war and militarizing our police and everything else that happens with our tax dollars. And no, we can't decide what our taxpayers dollars go to. But I was I was talking to somebody recently, and they're like, of course, taxpayer dollars should go for this, because if a rich woman has access, a poor woman should have access. So this really does, equalize the playing field, because if you can't pay for it, you don't have access. And it doesn't matter if Roe versus Wade stands and you have the right to an abortion. If you can't access it, none of that matters.
Right. This was one of the arguments that I thought came up that was pretty important to look at during the discussion on the 20-week abortion ban. Peggy Lehner, Senator Lehner, who's the former head of Ohio Right to Life, very anti-abortion. She was trying to claim that none of the abortions that happen 20 weeks or later are due to rape or incest. She says by then they've taken care of that already, which, I don't believe her at all.
Wow.
No. But then they also tried to minimize the number of abortions that took place at 20 weeks or later because of fetal abnormalities. They said, oh, this doesn't really happen that often. Mm-hmm. And so I sort of looked at it as a logic puzzle. It's like, okay, well, if you're saying that it's not because of rape and you're saying that it's not because of fetal abnormality, then what's left? And she was really clearly trying to just claim that women are lazy. Mm-hmm. But I think if you take out, abortions that happen because a woman was raped and you take out fetal abnormality, the big thing left that you're not talking about is how are women paying for these procedures, and how long did it take them to come up with the money to pay for an abortion? So, if you want fewer second trimester procedures, then the clear way to reduce the number is to make it easier for women to afford first trimester procedures.
Yes. Well, and not put 24-hour waiting periods in place, and not, make all these hurdles for them to jump. But yes, that is really one of the biggest reasons why women delay access to care. And unfortunately, it kind of snowballs on so many women, because if you need $500 at, 9 weeks, and it takes you 2 more weeks, 3 more weeks to come up with that $500, you're now at 11 and 12 weeks, and that price has gone up because the procedure is still safe, but gets more complicated as you go through pregnancy. So often a woman will finally come up with the previous amount that she needed, and now needs additional funds to be able to get the procedure. So it snowballs on poor women.
Right. So we'll definitely be keeping an eye on Illinois to see, we're looking at Ohio's data on how many abortions are performed here and what other statistics we can find. Illinois' data is going to be really interesting to look at because, ideally we should see some good trends here, both in terms of, how women are, how frequently this is being used by women, but also what other sort of positive health effects come out from that. As we look to Ohio, we still have this Down syndrome ban has been getting quite a bit of headlines lately. It hasn't had a hearing since the last time we talked. So that's one thing going on at the State House.
Yeah, and right now it's not really going anywhere. The House is taking a couple of weeks off for some reason. They just randomly do that. So,
Right.
so they're not actually back in session until the week of the October 9th. So we're looking at the 11th is probably the next time we'll see that hearing. We're going to try to pack the room. It's 9 a.m. on the 11th. There's a Facebook event page. You can find it on our Facebook page. So that's coming up. But then next week, we are actually seeing a Senate vote on the reappointment of Ohio Right to Life President Mike Ganadakis to the state medical board.
Right.
So here's a guy who has conflicts kind of all over the place. So, he's got the conflict of he's the president of Ohio Right to Life and is on the state medical board. He was for a year president actually of the state medical board. So, he's president of an organization who complains to the state medical board about abortion providers. And then he's the one who investigates them. Think about that for a second.
Right.
But then also interestingly, last year when Ohio passed the medical marijuana stuff, a lot of the rules on how physicians can dispense and the dispensaries and those kind of things are going through the state medical board. And interestingly, Mike Ganadakis also does some private consulting as a lobbyist for various places like the pet store Petland. And then he picked up and added a couple of marijuana organizations as a lobbyist. So now he's lobbying for these organizations that want to be able to distribute legal marijuana in Ohio. And again, on the state medical board, making rules for how marijuana gets distributed in Ohio.
Right.
So yeah, that's happening tomorrow. I mean, not tomorrow, next week, on Tuesday at 3:15. So keep an eye out for your email. We're going to let people know about this. And I think also the biggest part that I think just angers me on kind of a basic level is how he talks about abortion not being healthcare. So here's somebody on the state medical board that regulates doctors who provide abortion because it is healthcare. I mean, Ohio law requires a doctor to do it. If it's not healthcare, why do you require a doctor to do? And, and here he is at a press conference 2 weeks ago after the Capitol Care case behind a sign that says abortion isn't healthcare, standing next to somebody from Created Equal who stands outside of healthcare providers' offices and harasses them, drives trucks around their neighborhood and calls them murderers. And then cites statistics from Operation Rescue, where Cheryl Solinger, their co-leader, spent time in prison for attempting to firebomb an abortion clinic.
Right.
So this guy who hangs out with all these upstanding citizens, air quotes, is on our state medical board and in charge of regulating medical providers in our state.
Yeah, it should not be.
No. So that'll be coming up next week. Keep an eye out. We'll put some stuff in the show notes on that too.
Okay. So from state legislation and state crazy medical boards to national stuff, Cassidy Graham came up and went down. It has failed. Tomorrow was supposed to be like the big showdown date, September 30th. But they just clearly did not have the votes.
Nope.
So Obamacare stands, and yet another attempt to destroy the Affordable Care Act gets thrown in the what's Penn's ash heap of history or something.
Yeah, it's dead. Woohoo! I mean, there's plenty of reasons, plenty of places where it could come back in various forms and, budget reconciliations and things like that next year and those kinds of things. But for now, well, calls, everything worked.
Right.
We'll see what happens.
Yeah.
Definitely defeated the zombie bill for now, but for sure, I think it just goes to show what we can do when we continue to organize. And I think we do. We have momentum on our side, and people are seeing that these attempts are just ridiculous. Just deny people care. I mean, people see right through that.
Right.
It doesn't stop people with pre-existing conditions from getting healthcare. Oh wait, yes, it does.
Right.
Yeah.
Trump tweeted that. He said, no, it doesn't stop people from getting, care if they have pre-existing conditions. So you've got the president tweeting things that are clearly wrong, and obvious health professionals calling him out. Right. All 50 states Medicaid directors stood together, signed a letter saying, hey, this bill is terrible. The usual suspects in the healthcare community, the leaders, the American Heart Association, Diabetes Association, and all of that stood against it. The big headlines came yet again, a second effort here, spearheaded by Jimmy Kimmel, of all people, to take this bill on. It did not pass the Jimmy Kimmel test. And so that, it's really incredible. But I think more than all of the actual medical experts, the stand-up comedian on late night TV talking to that audience that normally doesn't hear anything about these sort of pieces of legislation, but him taking this clear stand was very effective in turning the tide against this. And honestly, he kind of carries the water for a lot of advocacy groups like us that are trying to get people out. And no matter how hard we try to talk to folks, there's a level of saturation that we just can't achieve that someone on late night TV just instantly gets.
Yeah.
And thank God he's used it for good.
Right.
That's right. Well, again, it goes back to our previous conversation about if the healthcare that you need exists, but you can't access it, does it really matter anymore? And I think that was his major point, was at any point in time, I'm going to be able to afford the heart surgery that my baby is going to need. But, factually, Trump's tweet was accurate to a degree, because insurers were still going to be required to provide a plan that would cover pre-existing conditions, but they could charge exponentially more money. So a woman who needed coverage for pregnancy, they could be surcharged like $17,000 for that, plus all the premiums and all the deductibles and everything else that you had to pay out of pocket anyway.
Right.
So if you can't afford that coverage, it doesn't matter if they're required to give it to you. If it costs, $50,000 a year, you're not gonna be able to pay it. So
right. Cassidy Graham. Cassidy is Bill Cassidy, Senator Cassidy. Graham is Senator Lindsey Graham. One of the points we were making on Twitter was that Lindsey Graham, when he was running for president alongside John Kasich back in 2016, one of the things that we did as just a natural part of the campaign was we looked at the anti-choice records of all of the candidates. And you had a lot of big names out there. Mike Huckabee obviously is a horrible anti-choice extremist. Wasn't Newt Gingrich in the field?
Yeah,
He's, all of these guys. Kasich, because of the sheer volume of votes that he cast in Congress and bills that he signed in Ohio, had one of the most extreme anti-choice records of all of the candidates that stepped up on that first stage.
What was it, 12, 15? I don't even remember.
Yeah, far too many people. Kasich had one of the most extreme anti-choice records.
Yes.
He didn't have the most extreme as long as Lindsey Graham was in the race. Lindsey Graham, because of the amount of time that he's been in Congress, has cast more anti-choice votes than any other person that was up on that stage. And you had people that were really rabidly anti-choice. but they hadn't actually signed bills or cast votes. And
All
Lindsey
dark, nobody.
Graham, the most extreme anti-choice record of any candidate that was running in the 2006 presidential race. And so this bill, would have done horrible things to women's access to health care. And so it's really good that this didn't get adopted. I know there was a lot of fuzzy sort of questions about what exactly this bill would do. It clearly would have destroyed access to providers like Planned Parenthood. It would have been very bad for women's health care.
Yes. But to prove that they aren't going to just stop being jerks now that that's failed.
Right.
Like the same moment, it was almost in the same breath that Graham Cassidy died. The headline changed to, and now they're going to vote on a federal 20-week abortion ban.
Right.
It's whack-a-mole.
Yeah.
Yeah.
So the House is expected, the U.S. House is expected to vote on the federal version of a 20-week abortion ban. From my understanding, it looks nearly identical to what Ohio passed and several other states have passed. So again, it's 20 weeks post-fertilization, not 20 weeks gestation. Again, using non-medical words that don't actually exist because we can't calculate fertilization.
Right.
So it's really kind of like a 22-week abortion ban because we don't calculate pregnancy from fertilization. Go figure. Let's go to medical school before you regulate medicine.
Right.
So we'll see what happens. I mean, in the Senate, they have to get to 60 votes, and I don't know that they have the 60 votes, although we do have Democratic senators who are not with us on abortion rights.
Right.
So, it's probably easier to get 60 votes on something like the 20-week abortion ban than it is repeal and replace of Obamacare. But the House, definitely has the votes to do it. So I wouldn't be surprised to see a successful vote on the 20-week ban in the House next week, or the week after.
So I haven't seen the legislation. I don't know if you have either.
I haven't read the whole thing, but
do we know this is pretty much the same piece of legislation as what Ohio passed? It's
very similar. From what I've been reading, it sounds very similar.
They didn't start from scratch and coming up with the idea. They threw state legislation on a photocopier and wrote for Congress on the top. That's how it works.
That's exactly how it works.
Okay, so that's something that's very serious for the nation to oppose. Here in Ohio, however, we already have this law in place. If it passed on a congressional level, and because it's unconstitutional, it would get probably a challenge there. If a federal 20-week ban was enacted and then struck down, would that also strike down state legislation? I'm kind of going out on a limb here and asking this.
With the disclaimer that I didn't go to law school and there's not a JD after my name. It's generally my understanding that yes, because it would go through a federal court system. There are already 4 or 5 challenges to the 20-week ban that exist out there.
Right.
And we've won every single one of those. But they're all still very early in the federal court system process. So it would kind of depend on whether or not what circuit it went into. I would guess they wouldn't try it in a place like Ohio, Kentucky, or Tennessee, because the Sixth Circuit sucks.
Right.
But you can look to like Illinois or one of those states to kind of start one of these things, especially when it's federally passed. So it would really depend on if there was a split in the circuits, because that's what makes the Supreme Court start paying attention to it. So if it was a 5th case where the court upheld it and everybody was kind of all on the same page, then the chances that the Supreme Court would take it up are less. And we would need it to go all the way to the Supreme Court, and we would need to get a very broad ruling, kind of like we did on marriage equality.
Okay.
So it could, but it's a scenario that would take a long time, and depending on who else Trump gets to put onto the U.S. Supreme Court, could not go so fabulously.
So sorry, just to restate what you said so it's straight in my head. If someplace, Massachusetts, much more liberal than us, if they challenged it and it went through their federal courts up to a certain level and was struck down, but didn't continue to get up to the highest court in the land, that wouldn't apply at all to Ohio.
No.
Okay. It would have to go to a full Supreme Court, or if the case originated from somewhere in Ohio, which is like we said, not likely.
Yeah. So you saw that with marriage equality. So you had various circuit courts, not the sixth, because we were the one who screwed it up. You had various different district courts, federal district courts, who said, yes, bans on gay marriage are unconstitutional. And those like 4 or 5 states that are covered under that, then marriage equality existed in those 5 states. It took the U.S. Supreme Court with a very broad decision to make that happen in Ohio and all the other states that weren't under those individual pieces.
Okay. So keep an eye on that. That's not the only thing that Congress is working on. Paul Ryan and Donald Trump have these ideas of passing tax reform. We have friends that, because we work in state politics, have been talking about the impact of state budgets. So I'm used to looking at state level tax policy, but I believe the principle applies at the federal level. If they reform taxes and they give people a tax cut, and they hand it out to your average person on the street, but then they also hand out a big tax cut to millionaires and billionaires, it reduces the amount of money available for the government to use. And so then when it comes time to actually fund programs like Medicaid and Medicare, they say, oh, sorry, we're out of cash. And the reason that they're out of cash is because they passed these tax cuts and everyone thought, oh, I'm getting a tax cut, so this sounds like fun. But really, it's just the beginning process of destroying access to healthcare and other important government resources for people later down the road. This to me sounds very destructive. It's just harder to talk about than other direct threats to people's lives.
Yeah, and I think another interesting similarity that I was thinking about. So one of the things they're talking about it as a blue state retribution piece. I guess a lot of highly democratic states have really high state and local tax rates because they have fabulous programs that they fund with these things like Medicaid coverage for abortion and things like that exist in California. And so in those states, that state taxes you pay are deductible on your federal tax. So you pay a higher state and local tax rate, but then you get to deduct it from your federal taxes. So it kind of all comes out in the wash. Well, they're going to get rid of that so that all those blue states that didn't vote for Trump and all these people who are in office can't kind of hide under that, well, we can increase it, but you get to deduct it over here. So it's okay for your personal finances. All these people are going to pay way more in taxes because of that. And then, Congress can say, well, we still gave you a tax cut. It's your local and state government that's the problem. So, there's that, and there's all kinds of things, a lot of corporate tax breaks, because they say if they give corporations tax breaks, they'll hire more people, but corporations have been sitting on record amounts of profit for the last couple of years and don't seem to be hiring people now. So I don't know how, increasing the amount of record profits that they're holding on to and giving to their shareholders are now going to make them hire more people. It's all ridiculous.
Right.
It's stupid. They need to not do it.
Okay. We're past the half-hour point where I have to trim for radio. You want to talk about the NFL real quick, or do you have other things you need to do?
We can talk about the NFL. Can we talk about not just the NFL, because it's not actually just the NFL?
That's correct. Go right ahead.
So the NFL got really a lot of press about it, but actually, other than really the person who started it all, Colin Kaepernick, not being employed right now, the players who are doing it aren't being fined. They aren't being, punished by the NFL. But there is one player who is being threatened with major fines and being forced to sit, is Megan Rapinoe from the U.S. women's soccer team. She's the one player on the U.S. women's soccer team who is continuing to. She started it right after Colin Kaepernick did. She did it. Actually, they played a match in Columbus last year, right after this all started, and she knelt for the national anthem. And at that point, U.S. soccer said, "No, you're not allowed." It is actually a rule in the rules for the national team members. And my guess is that all national team members, I don't know if it's just U.S. soccer, but I know for sure it's U.S. soccer. So
I hadn't heard this at all.
Yes, I saw another article about it yesterday. So they're actually threatening to fine and force her to sit and those kinds of things because she's continuing to kneel. She did it again, I think, last week at a match.
Oh, you think after this past weekend that they've got to drop that fine? I mean, they're going to look horrible doing that. I mean, they would have looked horrible before, but now it's the Jimmy Kimmel effect. You're getting attention in an audience that wouldn't have been paying attention beforehand. Jamel Hill, the ESPN commentator, who's been a big both target and subject of a lot of these discussions because she's been critical of Trump, which I'm completely in support of her there. She was pointing out that the WNBA was taking stands, supporting Colin Kaepernick last year during their season. So women's sports have been much farther ahead of the curve on this than the NFL has, which is cool.
Yeah. Well, and I mean, the NFL really only exploded because Trump had his little hissy fit on Twitter. I mean, you would not have seen what happened last week happen if Donald Trump hadn't sent those tweets out. You would have still had the smattering of players who were kneeling already, continuing to kneel, but you would not have seen teams not come out onto the field and whole teams kneeling and those that
and owners joining them.
Right. Yeah. And I think other people who are they cover sports more than we do have really discussed this to death over the past week. But there is a kind of a diluting of the message. Kaepernick was clearly taking a stand against a racist system. That the biggest and most egregious part of that was police violence against Black and brown people. It's, I think, obvious that many of these athletes that were participating in the protest this week were doing it because they were standing together as teammates. And, I think all of them wanted to stand up either or take a knee as Black athletes who were standing, against the president and his comments, or they were supporting their teammates. So, I don't think anybody was taking a knee for the wrong reasons, but they're all now taking a knee for a different set of reasons, some of which are why Colin Kaepernick started this in the first place, but others, are maybe just really angry that the president of the United States, called them some pretty nasty names, which is a legit reason to protest.
Yes.
But it's not the same. And then there were a couple team owners that people were really scratching their heads and being like,
you voted for Trump, really? You donated millions of dollars to his campaign.
Donated millions.
Well, the optics look good, so join now for solidarity.
Well, yeah, and I think that is it really has gotten diluted. It's become, they're protesting the flag, they're protesting the national anthem. No, they're protesting police murdering Black people on the street. Excuse me. And so, really making sure that message doesn't get diluted further is really critical. And we really need to be talking about it. Although I did see somebody made the comment that, so if you think, people protesting racism is people protesting America, you do kind of have it right, because America is racist. It kind of says more about you than anything else. But yeah.
It's your right to protest.
Yeah.
That is actually being patriotic.
Yeah, I did like all the veterans who were kind of saying, actually, I fought to protect your right to protest. You can do whatever the heck you want to do. Thank you very much.
Right. Okay. So we'll see what happens this weekend. Speaking of this weekend, let's get it on. Talking about upcoming events. Tomorrow in Washington, D.C. Is the March for Black Women. Yes. Jasmine Burnett joined us last week to talk about that. Should be a terrific event on the National Mall, standing up for, Black women standing up for themselves. She was talking about many members of Congress are scheduled to be there to support the community of Black women, some of which include like Maxine Waters, who's really amazing.
Awesome.
Anti-vaccine, yes.
So we hope that event goes good. If you happen to be in Washington, D.C., then you can join that. If you're here in Ohio, in Akron tomorrow, September 30th, there's a protest against crisis pregnancy centers. Why is that important?
Well, similar to what we did in Columbus and Cincinnati in July now. God, it feels like yesterday and forever ago.
Right.
They were going to make sure that people understand that healthcare doesn't happen in crisis pregnancy centers. They are centers that mislead and coerce women out of having an abortion. If the woman thinks that is the best thing for them, they should not be given misinformation and made to feel shame and stigma because of that decision. So we're going to make sure that people know where they can actually go and get real healthcare in Akron, and just make sure people understand what that center is.
Right. So our supporters will be protesting against Pregnancy Solutions and Services, which is 3136 Manchester Road, Akron, Ohio, 44319. So tomorrow morning, 11:30 to 2, if you're in Akron, you want to participate in a terrific action. We'll put the Facebook event for this in the show notes. If you are on our email list, hopefully you've already gotten an email inviting you to this. You can sign up for our emails at prochoiceohio.org.
Cool.
And then the last one I got here is October 4th. The Repro Health Happy Hour is going to be in October. Wild Goose Creative, 2491 Summit Street in Columbus.
Yeah, pretty much at like Hudson and Summit.
Okay. That's your neighborhood. You just
I know.
Walk
I could
home.
like ride my bike, except for the fact that there's a bridge that's completely out, which is like the main artery between my house and that place. So it actually is not as close as it seems at the moment. At some point it's supposed to reopen, but it's not. I think the other thing we want everybody to do this week we celebrated National Voter Registration Day. So everyone should go out and check their registration, because Ohio has done a lot of purging and cleaning up and ridiculousness with their voter rolls.
Everyone should check their
Everyone. So Google the Ohio. We'll put the links in the show notes too. But if you don't check the show notes out, do a Google search for the Ohio Secretary of State. You can check your voter registration status, and if it is not correct or you can't find your voter registration there, you can actually now register to vote on that same website. So we now have online voter registration in Ohio. So it's really easy to do. So check your registration and make sure that you re-register if you need to, because the deadlines for this year's local election are coming up in a couple of weeks.
But your voter registration will still be good for next year.
Yes.
So it's great if you can just
just
take
do it
care
now,
of
and it'll be good forever as long as you keep voting, which
Right.
you should do every time you are able to.
Okay. Sounds
Again
good.
and again.
Okie doke.
Uh-huh.
Okay.